I'm Dr. Maria Funicello, chiropractor in Scottsdale, Arizona. Many of my patients experience anxiety following an auto accident, and while I can adjust their spines to calm their nervous system, I haven't really been able to help people cope mentally with the anxiety following an auto accident. So today I have Dr. Kelsey Walsh, psychologist, here to help give us some tips with coping with the anxiety following an auto accident. Hi, Kelsey.
Hi, Maria. So after an auto accident, it's very normal for you to have mental, emotional, and physical symptoms associated with the trauma. So usually that's your fight or flight response really activating. So if you've been in an accident, sometimes if you've even witnessed one, after you get in your car, you may realize that you're a little bit more hypoaroused. So your heart rate's increased, you might be sweating, shaking, it might be a little bit more difficult to concentrate. So one of the things that we want to help you do is to relax, learn to relax again in the car so that your body can start learning that it's not always a threat to be in the car. So our number one way of doing that is deep breathing. So deep breathing activates it's the parasympathetic nervous system. Your sympathetic nervous system is activated during your fight or flight response. So when we do deep breathing, it's the relaxation response that we want to do. So deep breathing is all about slow, steady inhale and exhale. It's breathing from your diaphragm. The one I really like to use is called 4-7-8 breathing. So you breathe in for 4 seconds, hold for 7, breathe out for 8 seconds. And they're fast seconds, so don't think it's a really long time. But there are a lot of different patterns, so try them out, see which one works for you, and deep breathing is kind of the way to go in the beginning, because you may notice that you're holding your breath when you're in the car or you're breathing very shallow. Another technique that can be really helpful is positive distraction. So what I like to recommend is getting a playlist or a CD of songs you really like to sing along to. The singing or humming will help you with your breathing, but it also gives you that positive distraction so your mind isn't kind of subconsciously thinking about the trauma that you experienced, and you can more focus on the here and now. So if you like Broadway show tunes or if you like rap, find whatever is going to distract you in the moment. And the last
thing, in a good mood too, singing.
Yes, so it's a good positive boost as well. The last one that you can do is called grounding techniques. So it's about presenting or grounding yourself in the here and now, also in your current environment. So you can't do a lot of scanning ones because that would be dangerous while you're driving. But one you can do is to focus on your 5 senses. So kind of have an internal dialogue of things you see, hear, can smell, taste, and what you can feel on your body. And that helps you ground in the present moment instead of when we experience traumas, we tend to live in that past moment, which is why we get activated while we're driving. So it can take some time for our bodies to relearn that driving is not a threat. So just be kind and patient with yourself. And if you need professional assistance, please find someone that will be able to help you cope with the mental, emotional, and physical symptoms you feel after a car accident.
Thanks, those are great.
Thanks.